put out by a fake Twitter account. That's why we will follow our protocols regardless of what information is leaked to the press or put out on social media. And at this time, I would ask Director Stapleton to give you some more information and specifics.
Good morning. Thank you, Madam Chairwoman. I want to give you a little bit specific where we are as of this morning on the cases we have quarantined. Of course, isolation is different than quarantine. Right now, we have 22 quarantined individuals in Niagara County. All those quarantined individuals are asymptomatic, meaning they do not have symptoms. They are quarantining in their homes, their private homes. We also have one positive case. That case is in isolation right now as we speak. She's in a local hospital and receiving care for her illness. She's a 42-year-old female with a compromised immune system. Once again, she is isolated. And we are doing contact tracing right now at this moment, finding out who was this individual in close contact with, family members, anybody who might have visited her home. Those are the things we're doing. We started that last night, and we've been doing it throughout the night, and now we're doing it this morning. So once again, the contact tracing is going on right now. We take this issue very seriously. It's important that people realize that we expect and we believe that there are a number of positive cases throughout Niagara County and New York State that have not been identified. I am feeling a lot of frustration, the lack of adequate supplies in order to do sampling, to do testing. We have ordered over 1,500 swabs to perform testing, but we have not been able to receive those yet, and those are still back ordered from the New York State. So that's causing us some frustration, it's causing delays. Don't get me wrong, people are being tested, people are being swabbed and tested, but it's not the level we want it to be. We stand ready to perform that swabbing. We have a plan in place. We need to get those supplies before we can put that plan into action. So the number of people who are being swabbed, the number of people who are being tested is not where we want it. But the Niagara County Department of Health is ready to implement that plan as soon as we get those supplies. Once again, I want to give out the 1-800 number that the New York State Department of Health is manning, so people have that. This is important. It's manned by individuals who are epidemiologists, providers, people who are trained for this type of information. The number, once again, is 1-888-364-3065. Anyone who has questions should automatically call that number. However, if you have a medical issue, you have symptoms, call your doctor's office. Do not go directly to your doctor's office. Call the office first. If you do not have a primary care physician, or you can't get a hold of yours, do not go immediately to an emergency department or to an immediate care center. Call them first. We don't want people who might be symptomatic, might have COVID, to go to those facilities and infect others. Once again, people should be staying home. None of that has changed. Once again, keep your children home. If you're sick, don't go to work. Don't go out in crowds, those types of things.
Thank you, Director Stapleton. Director Schultz and Sheriff Felicity do not have official statements this morning that they want to make, but we did want him here for questions if you had them, because we know that those are important things that could come up. At this time, are there questions that we can address for you?
Can you comment on?
We had one over here first.
What is the testing capability right now? I know you have 1,500 out back orders. What can you do now?
We have 4 pending cases right now. There are a number of testings that's being done through private physician offices, but we have a difficult to be able to provide more than, say, a half dozen a day. We have the capability to do a lot more once we get those supplies.
So if it's a half dozen per day, Erie County, for example, at their public health lab, they had 450 as of yesterday. They just got 200 today. What's the capability here in Niagara County?
We don't do the testing here in Niagara County.
Okay, it's just the private labs itself?
Yes, private labs. We want to do the swab. We'll do the swabbing, which is the sample you need to do testing. We can do that as soon, we have the staff ready, we have the plan ready, we just need to get those supplies.
Do you know how many people in Niagara County have been tested to date?
I can't tell you that. Once again, those are being done through private offices as well.
Can you comment on the location of the individual that tested positive? We have reports indicate they're being treated at Niagara Falls Memorial right now.
Yes, I mean, that information is out in the public.
Is it true?
Federal regulations prohibit me from speaking about a person's private medical treatment care location, so I can't answer any more questions regarding that. I will just say that yes, that person is located there, and you would need to speak with the hospital for any more official information than that.
In this western Niagara region, the 3 classifications?
Would be where they're
Okay.
from, yes. Right.
So you said this person was not on your radar, the 14 who were being tested, so I guess how long were they having symptoms for? How did they come about to be on your radar?
Once again, we won't comment on an individual person's symptoms, but they took the proper precautions. When you have symptoms consistent with coronavirus, then we tell people, isolate yourself, separate yourself. There are people who are self-quarantining in their homes that we're not aware of because they're not required to inform us if they visited one of those areas that was not under limitations prior to this just past week. So we want people, if they do have symptoms, they need to make sure they isolate themselves and call their primary care physician as soon as possible.
And to clarify, this, we believe, is a case of community spread. There was no travel or anything like that?
Correct, yeah. We have no information. My staff spoke with the patient last night. They spoke with the patient this morning. They're doing contact tracing right now. We have no information to make us aware that it's a connection with a person. We believe it is community spread.
Dan, a question for you. If you could talk about the partnership between Eastern Niagara and the county, the use of the old hospital in Newfane, how quickly could that be up and running if needed? What kind of work needs to be done, if any, in order to quarantine people there?
It could start today. I could start putting patients in there in an hour. So we're ready. We did not wait for the positive case to be announced. We did not wait for cases to grow. We started preparing for this weeks ago because we knew that this was a possibility. So yeah, we're ready to do that now.
What is the capacity?
A little over 30. When I say that, up to 32 people could be staying there. Each one would have their own private room, their own private bathroom. Those are 2 important characteristics. So that we could do 32 who would be able to meet that. And we're, like I said, we're ready to use that when we need to.
And in the release that you sent out yesterday, can you just go over some of those specifics about who could potentially be housed there? Because it's not the most serious of cases, correct? It would be just a quarantine situation?
Yeah, right now our plans are for quarantine patients. These are people who can't stay in their home. Because of certain circumstances, they may have one bathroom that needs to be shared with others. They may share a 1 bedroom with someone. They may have people with compromised immune systems. So our plan is for people who do not meet that criteria and it's not safe for them or the people they live with, that's when we would use the quarantine.
What part of the county was this case from? Did you guys identify that at least?
Yes, we said it was from the western region of Niagara County.
Western,
Dan,
okay.
can
And
you
in
tell-
terms of using DeGraff Hospital, is that something you're considering? And do you have the staff for that? Is there staff on standby?
We're considering any options in any buildings that could be used for this.
Dan, can you talk about when the county found out this person tested positive and what precautions were taken for the hospital staff that had to treat them as well as the responders?
All hospitals in this area have negative pressure rooms. Negative pressure rooms are used for when you suspect a case of any communicable disease. So the hospital, I'm sure they took the proper precautions. This is something they train for. This is something we work with them on. So they'll identify a person. If they have symptoms, they'll make sure that person is either put in isolation or put in a negative pressure room.
Will you be putting the list out like Erie County did, tracing where people might have come in contact with this person?
Well, I don't want to comment on that because we just started the tracing, but that's something we'll consider. But right now, we're making sure we have the tracing, going on.
Do you still plan to have these sort of press conferences? I know several other county executives, because of the concern over social distancing, have discussed not having in-person press conferences anymore.
That's correct. Our intention would be to have this probably be the last press conference in person. I mean, we already made a point of having just the necessary folks here to answer your questions, and I really would like to wrap this up very quickly. I know that you have questions you want answered, but we want to get all of you out of the room as well. So no, we would not want to do much in person in the future.
One more quick question. President Trump just tweeted that he would close the Canadian border to non-essential travel. How will that affect Niagara County?
In multiple ways, and we haven't had time to digest that. We were just hearing it as we walked into this press conference, so I don't know too many specifics about that, but of course we're worried about our businesses, our friends and family who live across the border. We're that close, so we need to digest that information a little bit and really think about it, but of course it's going to impact us in many, many ways.
So you said this person was in western region of Niagara County. Is there any clue as to what places this person might have went to, where folks should kind of try to stay away from in the meantime?
Not that we can discuss at this point. Director Stapleton just explained they have to go through an investigation with the person, find out where they've been, talk to them about those things, and then make the appropriate determination as to what information needs to be given to the general public as opposed to maybe phone calls to individuals who they know they were in contact with, things like that.
How long will that take for folks here to know?
Like I said, we've been working on that since last night and early this morning. We need to contact the people who might have been at a get-together, a party, whatever it might be. That's one of the main reasons why we're telling people, don't go to big crowds. This is a perfect example of why people should be staying home, should not be in large crowds, because everybody then in that crowd or that party or whatever it might be has to be talked with. So we're doing that now, and we're in the middle of doing that as we speak.
Was it a party? Condition? Is she okay? Can you tell us the condition?
I'm not going to comment on his condition, no.
So she was at a party someplace?
No, I'm saying those are the types of things we need to find out. Where do they work? Were they at a party? Were they at get-togethers? What's their occupation? Those types of things, and we're in the middle of doing that now.
Becky, can you comment on the legislature itself? Will you still be allowing a crowd into legislature meetings, and will they still be in person?
Well, our next meeting is not scheduled until we have committee night on April 13th with a full legislative meeting on April 21st. So at this point, we're not ready to make those decisions. We need to wait a few weeks and see how things have changed in that time, but certainly we are not going to have crowds together. That was part of the reason we did the special meeting last week, to give me a little bit more authority to sign contracts and things like that that were related to COVID-19, so that we didn't have to have them together. We have gone to phone conference meetings and briefings with different department heads and the local municipalities. We're not doing those things in person. We are not getting together.
Dan,
So.
do you know how quickly the 4 pending cases that you have, when those cases will be finalized, you'll know whether or not this person has COVID-19?
Yes, we have the 4 pending. Capacity is limited, but we hope to have those results within probably the next 48 hours. But once again, because testing is still limited but increasing, the capacity needs to be there. I'm hoping that, I believe Roswell Park is being discussed about maybe next week, that they'll be opening up their testing, which is very welcome. Private labs are up and running, so we're hoping that increases.
Throughout all of Niagara County, how many private labs are doing this testing? Forgive me if you mentioned that already. but I didn't catch it.
I'm aware of 2 private labs, but once again, those labs are increasing as they get approval.
Okay.
Can you talk these 4 pending cases? I understand there's limited location information you can give, but using this 3 part of the county designation that Chairman Whittish used, can you use that to identify where these 4 are?
Yeah, I don't have all the identifiers of what part of the region, what part of the county these individuals are from. Like I said, we're waiting. We have all that information. I don't have that in my head, but hopefully we'll have the results within the next 48 hours.
Dan, I'm sorry, you mentioned you said 6 a day. Can you clarify as to what that was? Is that?
Well, I'm talking about the ability for us to do the sampling and the testing, and that's a generic number, but we're trying to be able to do more than that. And once we get those supplies from the state, we'll be ready to roll. Like I said, we've got plans ready, staff ready to roll. It's just getting those supplies. That's what's restricting us right now.
Any indication when you would get those supplies? What's the state telling you?
The state is telling us we're in the queue.
What does that mean?
Exactly. Means the same thing to you that it does to me.
What about necessary medical supplies such as ventilators and whatnot?
Okay. I think at this point, folks, we need to wrap this up. I know that you have a lot of questions. Understand that we do as well. There are things that we're not hearing from the state, such as the testing equipment, the supplies. But first and foremost, I want this group to disperse. Again, it's our intention to not have people together any more than absolutely necessary. We felt this was important because that first positive test is something that people were awaiting, expecting, and wanted more details on. So I thank you again all for coming. I thank our sign language interpreter who's helping us get this information out to anyone who wants it and needs it. So thank you. And again, please, call us if you have questions, email us. We will get back to you as much as we can. Please understand we are being inundated right now with calls and emails from everyone. So we're doing our best to get the information out through press releases, on our web pages, our Facebook pages, all of those informational ways that we have. So again, thank you all for coming. I ask at this time that we all head on home, back to our private spaces. Thank you.
Becky, going forward, press
All right, everybody. That was a press conference from Niagara County, including Daniel Stapleton, who is the Niagara County Health Commissioner. And Ed, apparently one confirmed case from the western part of Niagara County, 4 pending cases, and 22 in quarantine who are not symptomatic.
That's right, but what you're hearing from Niagara County is echoing what you're hearing all over parts of western New York, especially from the governor as well on a New York State level, that there needs to be more testing. And it was Governor Cuomo himself who, he says, spoke with President Trump and Vice President Mike Pence about opening the state and other labs around the area to get more testing done, to give them the authority to do more testing. At this point, you heard the director of the Niagara County Health Department say essentially there are only 2 private labs right now that are doing testing for all of Niagara County, with 4 pending cases and the ability of only 6 tests per day. That's mind-blowing.
That's nothing.
Right.
For how this is spreading. And we've also heard that they had just gotten the news that the Canadian border is closing. And again, that's something else that will affect Niagara County.
So let me just, I was reading this tweet at the top of the show, and that's why I was looking at my phone, because it just came through. President Trump tweeted just a little while ago, and I'm going to read this to you. We will be, by mutual consent, temporarily closing our northern border with Canada to non-essential traffic. Trade will not be affected, details to follow, and we are expecting to hear from President Trump about that very issue, closure of the northern border, in just a little while. Here's the tweet right here. You can see that it obviously is getting a lot of attraction and a lot of attention. And when asked about this, the chairwoman of the Niagara County Board of Supervisors says that this will affect Niagara County in many ways and that they are worried about their businesses. Obviously, Niagara Falls front of mind, and when it comes to tourism as well, I mean, this is going to affect a lot of people, and just one more layer of the onion that we're peeling back now because of the spread of the coronavirus.
Yes, and when you think that summer is just ahead with all of those tourists who would have been coming through Niagara County, it's amazing. We'll also be hearing from the governor again, perhaps this afternoon, and also from Erie County again.
So I want to go over just some statistics here that that they put out this morning. We know that there's 1 confirmed case, but this one woman who is in the hospital now, she's 42 years old. She has some sort of an underlying health condition.
Right.
She took the proper precautions, but the important message here, and I think it was kind of buried within the press conference, was that this is part of community spread. This isn't somebody who traveled to Italy. This isn't somebody who traveled to New York City. This is a case of the coronavirus spreading throughout Western New York, and we have to operate under the assumption, essentially, that coronavirus is everywhere, despite the fact that there are only 20 confirmed cases in Erie County and that 1 confirmed case in Niagara County. We have to assume that everyone among us may or may not have it.
Right, be a carrier.
Exactly. So what do? You social distance yourselves. You don't go to places where there are large gatherings. You wash your hands. You cough in your sleeve. And really, if you are sick, you stay home. That's the bottom line here, because if you are showing those signs and symptoms, you shouldn't be walking into an emergency room. You shouldn't be going to the urgent care. You should be calling your doctor.
Yeah, that was another important takeaway.
Exactly.
If you feel those symptoms, do not head to your doctor's office. Call first, because the right thing to do might be to stay home until further notice from your doctor. Once you go to the doctor's office, you could be infecting another whole group of people there.
And there are so many questions about what exactly is going on here, and do I have a symptom? Do I not have a symptom? Should I go to a doctor? Should I be tested? There are two really important numbers for you to call. In Erie County, it's 858-2929. Again, 858-2929. That goes right into the Erie County Department of Health. Those are for more generic questions, but then they also issued a New York State Department of Health
That's
number.
right.
It's 888-364-3065. Again, 888-364-3065.
Yeah, and it almost seemed like, they're obviously doing everything they can, but they're kind of stymied by the fact they don't have enough supplies
Right.
to go ahead and do the testing. They've got the personnel, they've got the area to put people in, but they're kind of hamstrung until they get more supplies. Thus, the rest of the states, same thing.
And you can feel the frustration
Right.
when they're saying that. When asked, where are these supplies? The director of the health department says essentially they're being told from New York State that they're in the queue. And
Yeah.
when asked, what does that mean? He says, you tell me,
Yeah.
because no one actually knows.
Yeah, and they said they were actually standing by for this
Right.
a while ago, so they were ready on their end. So we're going to wait and see. But again, we should be hearing from the president again this afternoon, also from Erie County this afternoon, and perhaps the governor as well.
Linda, one more really important point here is that the governor himself has been talking specifically about finding more beds because, as I mentioned a little while ago, we could need upwards of 100,000 beds because of the spread of the coronavirus statewide.
Yeah.
Here in Western New York, there's a limit to the number of ICU beds that are available and accessible to patients who might need a ventilator or an ECMO machine, as Dr. Gail Burstein was talking about a couple of days ago. But what you also heard come out of this press conference is that Eastern Niagara Hospital could be up and running just like that, he says, within the hour, and could hold 32 people who need to be quarantined with their own rooms and their own bathrooms, which is really important for people who are sharing a home or who have children in the home or who may even live with elderly people because we know they're the most vulnerable.
It's amazing. It's like throwing the pebble in the lake, and we're actually watching the ripples now get further and further
Exactly.
apart and affects more and more people.